I'm Dr. Barry, licensed psychologist, and I really thought it was important to go ahead and give this update on Jodi Hildebrandt. This is something that I've been watching very close as a licensed psychologist. Individuals that are accused of things like this and that do have the ability to actively practice therapy. I'm glad that the Utah board moved swiftly on this situation, and I'll talk about at the end my concerns moving forward. So, yesterday, September 19th, Jodi Hildebrandt surrendered her mental health license. So she will no longer be able to practice as a therapist. So she was a licensed mental health counselor and she's accused of some horrific crimes related to Ruby Frankie's kids and the Utah Division of Professional Licensing. So every state calls it something different. That's what it's called in Utah. In my state, Virginia, my license is under the Board of Psychology. People who are licensed as counselors, they are under the Board of Counseling. People who are licensed to practice social work, they have their own board. So they have a social work board. And so every state does that a little bit different. Utah, it seems like it's just one division of professional licensing. So they worked with Hildebrandt's lawyer to secure a voluntary surrender of her professional license. And I think this is a good time to talk about the connections classroom. So let me share that real quick. So, the interesting thing about connections is it does not say that they do therapy. Let me go to their main page. It says that it's a different modality that psychotherapy cannot offer you. So it sounds like she was practicing more as a coach anyway and really wasn't doing therapy, but she was still a licensed therapist. So I think the board just wanted to protect the interest of clients and make sure that she would not be able to call what she's doing therapy. I do think she could possibly be able to still be a coach. And I hope that people see that the way that she was teaching, the things that she was saying, how problematic a lot of that was, her distortion, truth, and how she ultimately knew the truth, and the parenting advice and recommendations, which was just horrific. The things that she was saying, I hope that people do realize that it is not okay. But she could still be able to call herself this. So right here, I'm Jodi Hildebrandt, your mental fitness and relationship expert. So it doesn't say therapist. So I don't know how much of this she might have to change to be in compliance with the board. Because as long as she's not saying that she's doing therapy, she could potentially still do this. And I don't have anything against coaching. So I personally, I have done mental health coaching before, and coaching is different from therapy. So with my coaching client, it was a little bit more directive. It was not for major depression or for major anxiety. It was more just building self-esteem or working with somebody that was struggling to apply for jobs or something like that. So working with an individual on a very specific task that wasn't clinical, that didn't meet criteria for a clinical issue. So within therapy, there has to be a diagnosis if you're billing your insurance. So that's why some therapists do cash pay only because then they don't have to be limited by insurance restrictions. I've had people want therapy more than once a week, but if it wasn't clinically indicated, if their issue wasn't severe enough to where I was pretty confident the insurance company would pay, we would have to talk about like, hey, just a heads up, if they don't pay for it, then this is going to be the out of pocket cost. And often people they would just elect to be seen once a week in that situation. But with this, I am glad that she is no longer a licensed therapist. The story doesn't end there because, like I said, she would still be able to technically possibly run the connections classroom. Now, I don't know because they might have come to an agreement on what she could and couldn't do moving forward. But once you're no longer under the licensing board, they don't have any say. Like there isn't a board that oversees mental health coaching or relationship coaching. And so that's where I just tell people to be careful, do your research, check the reviews. I have worked with some phenomenal coaches, and then I've also heard of situations where boundaries weren't kept because within coaching, there aren't those same ethics and guidelines that I covered in that last video where I broke down the counseling and biomedical ethics that we have to follow when we're operating within a license. I hope this was helpful. If you all have questions, let me know, and I hope you enjoy the rest of your day.